Good morning. This is Harlan Pickett. Today is August 12th. It's a Monday. Get ready for the kickstart. Get your week started the right way. Good morning. Happy Monday morning. My name is Harlan Pickett. I am president of Eagle Care Health Solutions. As I do every Monday, 10 a.m. Central Time, bringing you the latest news and trends that are going on in the healthcare and health insurance world. Hope that you enjoy the show. If you have any comments during the show, please feel free to put them on whichever platform that you are listening in on, and be happy to respond to those. If you are doing so after the show, please do the same, and we will catch up with you then. All right, let's get right into this thing. So we had talked a couple of months ago about what was going on with Walgreens as far as with VillageMD, which they really put a whole bunch of money in. Initially, they put in about $1 billion. That's with a B, $1 billion. And then hey, okay, we're going to get even more serious about this. So they started in 2020 and 2021. They went ahead and invested another $5.2 billion. Yep, with a B. And so they're pretty deep in this thing. However, as they announced earlier this year, most of their $6 billion loss in the last year has also been almost exclusively due to their primary care business, VillageMD. So they have been closing some of those down, also looking for better ideas. One of the ideas that has now come up, and it was mentioned this past Wednesday in a securities filing, is that they are looking to possibly offload some or all of their stake in VillageMD. This is not surprising, I guess, when you think about how much money they've lost. I think what surprises many people on the outside looking in, including all of these investors, and obviously including Walgreens, is how does this keep happening? How do these big corporations keep jumping into this primary care space and not finding success? In fact, quite the opposite, right? Losing billions of dollars in their foray into trying to figure out what primary care is. I mean, the concept you would think is solid. When you just look at it from the outside, you're like, okay, so here you're already going shopping at this place, and maybe you're picking up your prescriptions there. If I could see my doctor there as well, wow, look at the times that I've saved in my day because I'm getting everything done at one time. But unfortunately, it doesn't always work that way. And what they're finding out is some of the inherent issues in fee-for-service. When you have a fee-for-service setup, in other words, they're continuing to use insurance. It's not a cash-based system. It is not a membership-based. It is a fee-for-service system. And therefore, when you're going through insurance companies, you are waiting for your reimbursement. Slow and low reimbursement can then put you behind the 8 ball. When you get that issue, and on top of that, you look at some of the areas I'm sure that those are in, have staff shortages, it's the perfect storm for exactly what's happened to them. It's not always the issue, because we've also seen some of the big players not have success even with virtual and telecare. But in this case, I think it's very easy to see that they jumped into something without understanding the ins and outs of it, and thinking that they would be able to overcome that with the volume. And that certainly hasn't been the case. We'll continue to take a look at this. We'll continue to keep you updated on what's going on there. But if you are affected in any of these ways by looking at primary care that you're receiving to a traditional system, or if your provider has been bought up by private equity, or if you are going to one of these type locations and you're concerned about what it looks like in the future, maybe you were one of those folks, obviously not a whole lot of them, maybe you were one of those folks that were going to one of the Walmart facilities that was shut down. If that's the case, there is a better option out there. You certainly can look at direct primary care to fill a lot of those needs. So if you have more questions about direct primary care, please reach out to me. Love to talk to you about it and find one close to you. I can help you do that as well. All right. Not surprisingly, ACA premiums to rise in 2025. Who would have saw that coming, right? Wow. ACA premiums going up. Yeah, it is definitely an annual thing. No doubt about it. Sometimes they go up a little bit more than others. Obviously, during COVID, we had a little bit of things staying the same because there wasn't near as much utilization. When people aren't going to the doctor, ain't getting anything done, low utilization, right? In fact, we're still seeing the fact that a number of insurance companies still owe billions of dollars. Yep, once again, that B word, billions of dollars back to consumers during that time because they charge more premiums than people actually use services. They're still reconciling all of that, and who knows when that will actually take place and the consumers get to get that money back in their pocket, but that is still occurring. Anyway, back to 2025. Right now, they are estimating that the average increase is going to be 7% across the 324 insurers that have said they're going to have plans for next year. That's about the same as it was for this year as well. So, 7% this year, about 7% again next year. But the interesting thing to me is the wide range that we see between those different providers. So it goes all the way from a health plan, just a health plan with a decrease of 14%, but also a health plan with an increase of 51%. So when you add all of them together, then you're talking about, you're getting that 7%. 50 of the insurers proposed a decrease in premium, and 85 requested an increase of greater than 10%. So will you see just a 7%? Not necessarily. It depends on where you live. I mean, everyone should know that by now. If you've been on the ACA, you certainly can see certain areas that are hit a lot harder than others, especially if you do this in multiple states, such as I do. You can see rates across the board where you're like, wow, this is pretty good. This person had little to no or even a decrease, where others you're seeing like that 51% increase. You're seeing huge increases that actually put people out of the market for that type plan. If you're not familiar with ACA in this particular way, the way that the subsidies are looked at is not based on these high cost plans. It is based on the average cost of the two lowest cost silver plans. So when you get someone that comes in, which we have almost every year, it seems like, someone comes in with a lower cost silver plan, it really affects the subsidy across the board for everyone in that area. And therefore, that's why people that have an increase in a place may have to change plans. Lots of craziness going on with all of that. But I would say that a 7% is just about what you would expect across the board there. Now, once again, could you be in an area where you're having a bigger increase? Absolutely. Absolutely. Remember, 85 carriers are saying, hey, we want something greater than 10% increase. So certainly there could be a higher price where you are at, and depending on the type of plan that you have. That is just going to be wait and see until we get closer to November 1st and we get to actually see the rates on what these plans are in accordance with what the subsidies are as well. All right. More bad news. Hey, how about that? Yeah, it doesn't seem like we got a whole lot of positive things this week, unfortunately. A recent report shows that we have about 700, a little over 703 to be exact, hospitals that are at risk or at immediate risk of closure. This analysis was done by the Center for Healthcare Quality and Payment Reform, and it uses data from CMS that reveals hospital financial information. And it shows that these are primarily rural hospitals. In fact, I believe almost all of them that were looked at were rural hospitals. And they fell into two categories, and that was risk for closure and then immediate risk of closure. And over half of the ones that were at risk for closure are actually at risk for immediate closure, which that is very concerning. Now, their definition of immediate closure is about 2 to 3 years. So we're not talking about like imminent, but their definition of immediate is that it could happen in a pretty short period of time, depending on the way the winds blow here. Once again, their thought process on this and the actual statement that the report makes is the primary reason hundreds of rural hospitals are at risk of closing is that private insurance plans are paying them less than what the cost to deliver service patients is. So when you think about that, you're like, okay, here's what these contracts say. And we know in particular, a lot of these folks complain about Medicare Advantage, and then we wonder why they're not accepting them anymore. Now, let's be honest, a rural area is not always the greatest for Medicare Advantage anyway, but that's neither here nor there. This is the situation that these hospitals find themselves in. Now, this is very much a have and have not situation. I had looked at another article that talked about the reporting of some of your major hospital, major hospital systems. Sorry, lost my train of thought there. Major hospital systems and the record amount of growth that they've seen and record profits that they've seen during the first half of the year. That does not trickle down. We're not seeing that in the rural areas. Maybe these guys have got doing a great job of their margin at 4 or 5%, but on the other side, the rural hospitals are not seeing that. And this is obviously a huge danger for rural America whenever you may not have a hospital anywhere close to you that can take care of your whatever's going on with you, especially emergency care. It wasn't too long ago that my parents lived in a very rural area that it was over an hour drive to any type of hospital. And so that means if you had some kind of major situation, you better hope that helicopter gets there fast enough to get you somewhere where you can get care. Well, that's already the case in many areas, but can you imagine if we started losing even more of those rural hospitals, what that would look like if the care is further and further and further away? So that's very concerning. I don't know what the answer is. The answer should be that if businesses in that area, unfortunately, there's probably not enough to support them, but if there were, doing direct contracts with those hospitals to pay them a fair market value for the services, and without them having to go through waiting for months to get denied claims or to be repriced claims that are less and well underpaid. If we could get to that point, I think we could be in a much better situation with those. But there you go. That's where we're at right now with rural hospitals. So I had a few questions last week about a little informational blurb that I gave about the Department of Labor providing guidance on the way employers could contribute for medical cost sharing. This is, it's a big deal to us. Obviously, we do a lot of that type business at Eagle Care. And so to us, it is a major story. If you, and let me tell you something, we've also talked to some folks that are working through this pathway with us or with somebody else, and they had no idea that this had come down. So if you have questions about this, if you want to know more about what this looks like and how you can avoid potential fines, potential getting in trouble with the Department of Labor. Nobody wants any of that, right? Nobody wants any of that crazy. If you want some information about that, then please feel free to reach out to me on LinkedIn or go out to our website, eaglecare.com, and you can reach out to me there as well. Love to tell you about what's going on with that situation so that we can help you avoid and help your clients to avoid that. All right. If we do not have any comments, then I'll go ahead and shut her down for the day. I sure appreciate everyone being here. Hope everyone has a extremely blessed week. Y'all take care, and we'll catch you next time. We're out of here.